Hi everyone, I'm here with Dr. Tom Van Eyck, and we have our patient over here, a 34-year-old male with what I would call some moderate to severe acne scarring as well as a traumatic scar of his cheek. And we're going to see the technique that Dr. Van Eyck does in order to improve not only the appearance but also the long term of facial structure for him. So take it away, Tom.
Thank you. As you said, this is a scar he had since a long time. How old were you?
8.
8. So he went swimming into a swimming pool. There was a broken bottle on the bottom, and that hit him. On top of that, he got acne scarring. How old were you when you had the acne?
About like 12, 13.
Mm-hmm.
And then it kept going and going and going, and then it started like fading, and all the scars happened.
Okay. What you see a lot is that people that have scars when they're like 15, they heal from it pretty nicely. But once you get past the age of 18, 19, those scars will stick.
And we have varying depths. I mean, you can see ice pick scars, box scars, and they're all in varying depths. Some of them are quite deep, and I'm very curious to see exactly your approach. So you're testing what, for the integrity of the skin right now?
Yes, I'm testing the strength of the skin, and I expect that where the skin is weakened because of the collagen breakdown during the inflammation, strengthening the dermis at those particular points will diminish the variation in strength and will improve the overall look.
Sure. Small little stick. And you're starting again in a lateral approach, correct?
Yes, I really do like to minimize variation in what I do as an approach. And then the skin itself will ask for strengthening wherever I can crease it.
So you're not really concerned right now about the actual location of the divots, so to speak, but I see now you're filling that. But you're going in between them as well.
Yeah, it's a combination of the two. So it's looking at, for instance, a crease you can provoke here.
Right.
Within that crease you have a divot here and a big one there.
And again, you're using your product Restylane because of its rheology?
Yes, it's quite stiff, it's quite grainy, it's really particles.
Mm-hmm.
And I want them to stick in the dermis where I put it and not to flow away to loose connective tissue underneath. You see the stiffening here, it does improve the outcome.
Correct.
And move my way up here.
Beautiful. So your entry points, I see, sometimes are right directly into the actual depression.
Absolutely.
So I know a lot of people try to do this by going from outside the depression, and then of course there's a problem of maintaining depth when you advance your needle. The product will send bubble up through the scar to the skin, but here you're actually entering right at the depression level and putting in micro deposits.
Yes, and since, I mean, you have seen the front pattern technique on the other patients.
Sure.
And you did see me using like 30% or 50% of the needle because aging is a global phenomena.
Correct.
This is so distinct, this is so small that it's just, in most cases, just a needle tip entering.
Yeah.
Because the skin adjacent to the pivot is unaffected.
And still a retrograde injection. You sort of find your plane and then you allow the product to flow back through the channel created by the needle.
Yes. Try to find a linear aspect in the whole scar tissue.
See the improvement already. It's impressive. It's a field effect. You're treating the entire area rather than just really treating those individual little depressions.
And as opposed to peelings and lasers, where you do treat the entire skin,
Right.
I really want to address it to the weaker spots only
Mm-hmm.
in order to reduce the, what I like to call the entropy of the skin, so the
Mhm.
chaos.
Well, this is really excellent because we know there's probably about 20 different things that can be done for acne scars, but not one of them is really outstanding. Otherwise, we would have thrown the other 19 in the garbage.
Mm-hmm.
So we've had technology, we've had peels. There's so many different energy devices that have been used, but this is really an amazing direct attack and doing what we should be doing, which is elevating the depressed areas.
Yeah, and if you look at the skin as being damaged by the damaged collagen because of the infections, then rebuilding collagen with hyaluronic acid is a logical approach to
For sure.
diminish.
What if he was still having active breakouts, that he was still having pimples that were occurring and there was an issue perhaps of some bacteria or something on the skin? Do you have any?
Yeah,
Aversion to doing it,
Yeah,
or-
you need to solve that first.
You have to, huh?
Yeah.
Using either topical antibiotic or something systemic to go ahead
Yeah,
and
like
quell it.
Roaccutane or
Mhm.
whatnot. I mean, that's a real dermatological
Issue.
issue
Mhm.
and solution. How are we doing?
I'm good.
Good.
Beautiful, beautiful technique. And if you were to predict, looking at the amount of scarring that he had, the amount of product that you would need on that hemi face, you would say what? 0.3 maybe? For a total hemi
Yeah,
face?
maybe.
Maybe that would be the total amount that you would use?
But we cut an extra box, so if we need to, we use 2.
2 syringes, you'll go that route.
Yeah.
So a little painstaking technique, this type of procedure. I mean, we mentioned it before, is not a patient that you do over a period of 5 or 10 minutes where you just flood the face with product. What you're doing is a more specific attack.
Yeah, and the rewards actually in watching that skin improve.
Which you see it doing. It's quite impressive.
And it's almost like playing a video game. I mean, you
Mhm.
squeeze, you see it moving, then you stiffen it, you squeeze again,
Right.
and lo and behold.
Yeah. Very good. And the comfort level is not so bad. It's very tolerable, especially with the fact that we treated the skin with a topical anesthetic for a period of about a half an hour beforehand. He seems to be tolerating it quite nicely.
Yeah, if he would not,
Yeah, my mom will be proud.
Your mum will be very proud of you.
absolutely.
Absolutely.
And if not, I mean, there's a way to apply numbing cream even longer, or switch to something like a liquid lidocaine if needed.
And you're talking about liquid injected?
Yeah, of course you can do so, a block.
A block, yeah, absolutely.
If somebody's really
Really uncomfortable with it, but it doesn't seem to be too bad at all. You certainly have developed a rhythm in when you're doing it. And then you have
see
that.
how nice that skin.
Yeah, that skin isn't breaking now. It's definitely reconditioning. It's amazing that you're able to actually have the needle enter just at small little indications like that, because the scarring usually makes it quite difficult to penetrate the skin. I mean,
Well, I come at the easy part, right?
Mhm.
I come in at the weak part.
I know that people who use cannulas and patients who've had thick skin like this, sebaceous skin, or a history of acne scarring, that where the scarring can extend down into the superficial sub-Q, they always complain about the fact that it's difficult to advance the cannula because of the thickness.
Well, that's the point. I'm searching for a needle that has a great tip to do the subcisions with.
Right.
Haven't found it yet.
Then you'll have to create it yourself.
Yes.
And that's the tail end of the scar that you're working on right now?
Yeah.
There it is.
And just constantly making that evaluation on
Yeah, and I'd love the people who are watching this video to notice the way that he uses the index finger of his free hand, which we call the smart hand, to actually tent the skin towards the needle so that his angle of penetration is really 90 degrees to the skin, even though his needle is flat to the skin. It's a very interesting technique.
And if you want to be safe, I would suggest not using the index finger, but if you're getting too close to your needle, you can switch to your thumb.
Mm-hmm.
So in case when you go through the skin by accident, you rather hit your own nail than your flesh. That's just a little pearl.
Fantastic. A little, oh, you got it. I was going to just wipe that up, not a problem.
Sorry, I'm not used to assistance. So.
Yeah, you're used to flying solo.
Yeah.
I'm here to slow you down. Beautiful. Excellent technique. And that scar is rather tethered, and yet you still seem to be able to elevate it.
Yeah, except from the tethering, it's in combination with the fact that the dermis is thin. So I don't take away the tethering with this technique, but I mean, it does appear to be less
Absolutely.
deep.
And as you mentioned before, I think this is something that obviously isn't done in one treatment. You would have the patient come back about 2 or 3 months later.
Yeah, especially when you have certain parts of the skin that are very thin. The equation hyaluronic acid plus skin might not be strong enough. But if you wait for 2 months for the skin to get stronger, then that equation gets better and better.
Sure. And you can feel the difference, I guess, on the second pass. When you're doing it 3 months later, you can feel the difference in the skin texture.
It's getting so much easier.
Yeah, you mentioned earlier you love to deal with thick skin. Most people shy away from it, but you love it.
Because I use it. I use the thickness, I use the strength. And if you are only injecting underneath the skin, it's quite difficult to raise it, right?
Absolutely.
But if you use it, then the strength is a plus, it's a bonus.
And your target is still mid-dermis as you're going depth-wise here.
Yep.
Beautiful. You can see the immediate result on some of those really deeper scars. They're really flushing up to the surface quite nicely. And now you're going beyond into the area what you feel is sort of a lack of integrity of the skin in that area.
Yeah, as we all have
Yeah, for
vulnerability here.
Mm-hmm.
Once we're in the neighborhood, let's make him a little bit prettier.
Mm-hmm.
Why not? Beautiful technique. And you find that those needles will be able to carry you through a thick-skinned individual like this for about a half a face before you have to change it?
Yeah, yeah.
He doesn't seem to be complaining, but
No, if
you can feel the difference when the needle starts to get dull, can't
yeah,
you?
yeah. This is just for beauty.
Just for beauty.
Mm-hmm.
I don't know if we can even use that expression. You love that idea, don't you?
You have a trademark, or not?
Just for beauty. It is your trademark. Why not? Any particular reason you might start with one side versus the other? Do you do the worse side before the better side? I think we were talking about you do the thinner skin before the thicker skin.
The only real reason would be if you have a patient that has the numbing cream on the other side still
Right.
present when you do this side.
Right, to allow it to act for a longer period of time.
Yeah. If not, and we have a bunch of fillers here, so we don't care. But if you are limited to one syringe per patient only, I would suggest to do the other side first, in the same direction,
Right. Before you do the crossing.
Yeah, and then look at your syringe, and maybe there's like only 30% left.
Right.
Then you can do 15%. Whereas if you would do 70% on this side,
Mm-hmm.
and you have 30% for the other side, you're in trouble.
You're in trouble. Correct.
But now we have a heap of material, so we don't care.
So now you're ferning, so to speak, in the opposite direction.
Yep.
So your injections are really going from medial to lateral rather than lateral to medial.
Yeah.
Right. Because I would have looked at that after you finished your first pass and said, I'm quite satisfied with that. I think I'll call it quits. But you're
You
taking...
could. Yeah, but I mean, there's always room for improvement, right?
There is always room for improvement. It's true.
Especially in cars like this, you can always do something to make it a little bit better. And it's super satisfying to do this.
Yeah, it is, because you see the result, the immediate result, and you also know that long term you're going to get even a better result.
Yes, and we've heard his story. We know he has been around to check on dermatologists and treatments and whatnot
And was refused everywhere.
Yeah.
They felt that there really wasn't anything much that they could do to make a significant improvement, but we're seeing a significant improvement now.
Absolutely.
It's really impressive. Yeah, I have to tell the audience that when we brought the patient in as a model, I've never seen Dr. Van Eyck so animated and excited to be able to inject somebody.
Like
I
a
said,
kid in
wow,
a toy store.
like a kid in a toy store, thrown the challenge and the gauntlet was thrown and he's
Yeah.
responding to it. So you're blending the area, that's going after that scar again.
You see it in a lot of scars that there's like a ribbon of very dense tissue,
Mm-hmm.
and because of the pressure on the tissue in the years after the scar, there's a ribbon of very weak tissue just adjacent because of the folding. So if you strengthen the weak and leave alone the strong, you diminish the folding, you see.
Yeah, look at the resilience that you have now in the skin is quite impressive. Stunning. It's a meticulous type of work that you have to really concentrate on maintaining your depth. Obviously, if the needle tip goes beneath the dermis, you'll find that there'll be no resistance on the plunger when you press it. It'll be too easy, correct?
Yeah, and then you just lose material in the depth.
Which won't really be very productive material, as they say.
No, it will blow up your face, but
Right,
it will not.
but it won't help the scarring. Or
No. The good news is that if you are clumsy and if you go through the right layer, the longevity of the gel in the dermis is better than underneath. So the good portion of what you do will stay longer than
the part that
the
you do.
flunky.
Right. So you're using little micro droplets. I mean, really, the amount of product that you're injecting is minuscule, but the result is unbelievable for the amount of product that's being used. I would say that you're probably coming up to now about, judging from what you have in your syringe, maybe a,
0.3 thinking when I'm finished here.
right, maybe 0.7 cc's of product. And we mentioned earlier the fact is that you don't like to rub the face or to massage it or to do any type of cleaning of the little blood droplets that are there.
No, I really want the healing of the skin to commence and not to stop, because we just would be uncomfortable with seeing blood.
Right.
I don't care how he looks in 50 minutes. I care how he looks in the next year, right?
Correct. Let those vibrant plugs go to work for you. Almost completed one half face. So most of your injections are limited to the area that seems to be the damaged area, but you extend it to the areas as well that are showing some loss of structure as well, as you said.
Yeah.
Mm-hmm.
You can imagine if you strengthen this here, there will be less tension on the more vulnerable part of the face. So that's helping that also.
And the area that you're treating now, that's very thin skin that you're dealing with.
Yep. Well, not in him.
He has thicker skin there. Yeah, right. It's his thinner skin, which is still thicker probably than mine.
But the feeling is the same. I mean, you lean against it.
Right.
And just let the needle tip go in.
And is the bevel in any certain direction, up, down, does it make a difference?
I prefer the bevel being down. Just because there is a tendency, if you're a novice, to put the gel just a little bit too deep.
Mm-hmm.
And you can imagine with the way the bevel is sharpened, that if the bevel is down, you have the tendency to go up a little bit, slide upwards, which I prefer rather that than going down.
Going down and having it sort of dive down into the sub-Q or into
That's
the
right.
subdermal tissue. Beautiful. Again, all structurization of the skin. Really working on the envelope. Hard for me to see from my angle, but are you treating some scar tissue over there, or is it just extension of your field?
Scar tissue.
Mm-hmm.
And I did see this tiny little one
On the nose.
on the nose. Let's grab it.
Again, so you're penetrating from the center of it?
Yep. There you go. There are some loose ends here.
Couple little areas on the forehead. No worry about vascular compromise here because you're staying intradermal.
Right. I mean, as long as you feel that there's a high resistance on the needle tip, you're
That's
in the
it.
dermis and you don't need to fear anything.
Correct.
Are you okay? Cool.
Thumbs up.
Switch.
Let's take a look. Let's tilt him a little bit more towards me just to take a look at already some of the impressive result that you've obtained on that side. Especially when you compare that was the worst side
Mm-hmm.
and take a look at it now compared to the better side. Really a beautiful job, Tom. And you have total volume that you've used on that side has been
0.8.
0.8. So you have 0.2 left in your syringe.
Yep.
Let's have you just turn your face a little bit so the audience can see what the story is. You can blot, but you shouldn't rub. Just for us to be able to see what a difference. Wow, it is really impressive. And then we'll take a look at the area that has to be treated here. And this side over here, you're dealing with ice pick and box scars as well. You have a little bit of depression over here and it extends up into the temple region. Certainly very challenging for somebody like me if I was to do the injections. I see some really deep areas over here that you're going to be put to the test. Again, starting from the lateral position close to the hairline, entering through the actual little depression or scar. Outstanding. So you sort of set reasonable expectations for patients before they actually come in for this. You're not telling them that you're going to look 100% smooth by the end of the procedure. You tell them that normally this is a plan in process over the next year. You'd see them again at 3 months.
Absolutely, and they must see an improvement. A slight improvement after the first time.
Right.
Um,
And then it gets sort of exponentially better as you continue along.
absolutely.
So judging from the way he looked at the beginning, you would say that this was a gentleman that would require a series of sessions over the first year of maybe 3?
Mm-hmm.
And then you say about once a year you see them and follow up for a little touch-up.
That's it. They never come back to the situation as it was.
Yeah. It's always better than when you started.
Absolutely. And the thing with acne scarring, because it's a dermal issue, it's a dermal damage.
Right.
I have a dermal solution.
Correct.
It's that simple.
Whereas you would think that some of the other topical energy devices would be an epidermal type of solution for a dermal problem.
Yeah, if you look at the issues, the deep scars are the ones that are the most difficult to approach with any energy-based device, right?
Correct.
They hit on the surface. I do believe that using peels in an ice pick manner, so filling all the holes,
Right.
does make sense to me.
So do you ever do combined treatments? I mean, will you do something like this and you'll use an energy device either before or after, or you use a peel
I
before?
don't own an energy-based device.
You don't own any energy-based device. You are a mono approach.
Yeah, I used them a few times. I think it's utterly boring. And if other people are happy to use them and to buy them and to make them efficient for them in their practice, please do. I will refer to you. But I mean, I'm in this business and I can do what I'd like to do the most and fill my days with that.
Mm-hmm.
So I'm very lucky to do that. I'm not going to fill my days with things that make money but that don't make me happy.
Good point right there, that's for sure. And of course, with a skin type like this, you're always worried about the fact of any light-based energy device, that there will be some changes.
Yeah,
the
let somebody else
pigmentation.
worry about that.
Uh-huh. You want to sleep at night.
Absolutely.
Well, as I said, you're getting a pretty impressive result with injection therapy in and of itself. There's no question.
And I'm not saying that it's the cure for everything. But just me not being on an island, I live in Amsterdam. There's so many people around that are good plastic surgeons or dermatologists or skin therapists.
Mm-hmm.
I don't need to have everything in my house. Just do my thing and that's it.
And do it well, as you do. Certainly are quite adept at being able to inject like this. Fantastic. It really is surprising to see how you're getting that type of immediate response. And I have a feeling it's not only a combination of the technique, but it's marrying the personality of the product to the actually anatomy of the region, to the layer in which you're targeting.
Mm-hmm.
I can't imagine this working with a softer product, for example.
It doesn't. You need something stiff, something grainy. Hammer Sundaram said once, it's almost like couscous or rice, right? It's grainy.
Right. It's grainy. Yes.
And that's exactly what I need. Because I don't want the volume. I just want the strength.
Excellent. You've been concentrating mostly on the scarring, and I'm watching you as you constantly are checking the skin for its resilience, huh?
Mm-hmm. Yeah, it's like a dance almost.
It is a dance. There you go. That's the line that I was looking at before that I said, that's going to be tricky.
So this is neighborhood help, actually. So I'm strengthening this area
Right.
in order to diminish the stress, the mechanical pressure on the weak part here.
Time to fern from the other side. No, he's going to do the same side of the face, but he's going to do it in the opposite direction. This is a type of cross-hatching technique that really has been a, shall we say, a modification or an evolution of the ferning technique. Originally, the ferning technique, which is the same type of technique, was done in both directions, correct, for the nasolabial folds.
That's where it started.
Is that-
And this is like fern pattern after you put the fern in a shredder.
After you put the fern in the shredder. So you're just taking little bits of fern and putting it all over the place.
Yes.
I guess that's one way of looking at it.
And it's the same principle. It's looking for linear dermal weaknesses.
Excellent. I'm just looking at this side of the face and I'm so impressed with the immediate result. And that will set back a bit, I guess, right? I mean, some of it is swelling. You're going to see swelling that's going to occur over the next day or two. You're not going to be bloated, but you're going to be a little more swollen over the next day or two. And then that sets back.
It's a stepwise procedure.
It is. And then the results look even more impressive as you get further down the road, around 2 or 3 months. When they come back, there'll be significant improvement, and then you take it again. And the same technique, right? You would not alter it or any, you just basically do the entire field again.
Absolutely, and the skin will demand where you put the...
It talks to you.
Yeah.
Yeah, I say sometimes the skin of the face screams at you what it wants. Beautiful. Just a painstaking technique, but nonetheless one that will give you results. It would be rather disappointing to go through this and not see anything that would improve, but this is definitely showing an improvement.
And the thing is, once you start with this technique, there's no way back.
It's a one-way street?
It's a one-way street because you know what you can achieve. It's very difficult to go back.
Yeah, we're going to be looking forward to seeing his post-treatment results, especially at 2 or 3 months, and after another session or two. And then to have to go through this once a year is something that's very worthwhile in order to maintain that. So we're ferning in the opposite direction, always with a retrograde injection. I'll mention that again because you're not pushing the product ahead of your needle, you're actually allowing the product to fill the channel that you create with that little needle stick.
That's right, because I want the gel to go where it doesn't want to go. I want the needle to go where it doesn't want to go.
Right.
Always searching for resistance.
Wherever it buckles. But you mentioned in an earlier patient that we were treating that after you started injecting, and when there is a little bit of swelling, a little bit of product in there, that you will see perhaps some areas that start, you think are buckling, but they're new, but they're not really. Because it's just a result of the fact that the difference now in the resistance of the skin on adjacent sides.
Yeah, and swelling does cause a new pattern of weakness, which is temporary, so you must not respond to that.
Right. We're just about done here. Beautiful. One of the nose has been elevated, the ones of the cheeks have been improved too. What would you say the percentage-wise of patients that you have to actually do a block on that you know, in order for them to be able to tolerate this?
2% at max.
He's certainly hanging in there, toughing it out, as they say.
Well, the good thing about this hyaluronic acid, there's some lidocaine in it.
Correct. So when
if
you go over
you
some
approach
areas,
the same area for the second time,
yeah, you've got some
although the
anesthetic.
numbing cream will have been ineffective because of timing,
Right.
there's still some lidocaine.
Beautiful. Very safe technique as far as temple, and we've discussed earlier in some of the other patients that when you use this technique, I don't see any bumps, I don't see any quote-unquote Tyndall or bluish discoloration of the skin. Just that line that I said, that's going to be tough.
Yeah, that's tough because this is a very thick, dense scar.
Right.
So I have to find a way to strengthen the weak.
Almost there.
There you go.
You did it. You're going to see the improvement right off the bat. Don't look at the redness, but take a look at the skin shape already.
Nice.
Look at that. Remember what your skin was like before? It's just
Yeah.
one huge difference. Really a massive, massive difference.
Nice.
Very nice. Really, really nice.